this moment all of my adult life. We have an opportunity to make sure that 2009 is the last year when the majority, 52% of American families have been forced at some time during the year to go without the health care that they need, and most of them are so-called insured. We can end this now. 14,000 people will lose their health care coverage today. 10 every single minute in this country. But finally, my brothers and sisters, we, at this critical moment in history, with a president who believes that health care is a right, and an activated and fired up America, we are going to get universal health care. Reform that we insist on will make health care affordable for every person. We have to fight to include all needed services and treatments, full reproductive health services for women, assistive technology support services for people with disabilities, mental health services, and prevention. It also means that we will break down all the financial barriers to care, no high co-payments and deductibles, no enormous cost sharing for prescription drugs. And we must fight to eliminate health care disparities. Every person, child, woman, man, must be guaranteed access to high-quality care. We will no longer tolerate health care disparities based on race, ethnicity, and gender, your health status, employment status, or income, what neighborhood you live in, your immigration status. The language you speak must not keep you from getting the best care you need when you need it. I had the pleasure of being invited to the healthcare summit that the president had at the White House, and had the opportunity to argue as forcefully as I could for the public health care insurance option, making the point that it's less expensive, more accountable, more affordable, more secure, and more responsive to consumers' needs. And next to me was a guy from the insurance company who then argued against the public health insurance option, saying it wouldn't let private insurance compete, that a public option will put the private insurance industry out of business and leave the single payer. My single payer friends, he was right. The man was right. Here's what I told him. I said, excuse me, sir, the goal of health care reform is not to protect the private health insurance industry. And I am so confident in the superiority of a public health care option that I think he has every reason to be frightened. Recent studies show that a public option will lower premiums by 20 to 30% and allow us to achieve the savings we needed to expand care. We don't have to rely on the experts, though. We have a real-life example of what it means not to have a public choice. Ask any one of the senior citizens here. My dear friend, Harvey Mader. Where are you, Harvey? You made it there. Do you know Harvey? looks like. Look at Part D. The insurance industry was successful in blocking a Medicare-administered drug plan, and the result is higher premiums, more confusion, and less access. Now look, I know that many of you here today are single-payer advocates, and so am I. I'm a co-sponsor of 676. And those of us who are pushing for a public health insurance option don't disagree with the goal. This is not a principled fight. This is a fight about strategy for getting there, and I believe we will. In 1993, many of us remember the heroic effort that now Secretary of State Hillary Clinton made to get universal health care. Here's the difference. We did not have a mobilized American people out there ready to fight. You are the reason that we're going to be able to pass health care for America now. So thank you for this fight. We're going to win it.